Hi, my name is Dr. Nathan Garrett, and I'd like to personally welcome you to the Intimate Wellness Institute, the most expert center in the Mid-Atlantic for urogynecology, cosmetic reconstructive surgery, minimally invasive surgery, and intimate wellness for women. Welcome to our practice. Issues with pelvic function, bladder problems, intimacy issues are too often ignored by most professionals. Our mission is to ensure that women are heard and well cared for and empowered to make healthy decisions in their lives to take care of these problems. Our passion at the Intimate Wellness Institute is to ensure women are educated and empowered to make good decisions about their quality of life regarding pelvic issues. We're constantly striving to find new therapies, better ways of taking care of women, more minimally invasive therapies, and we'll share that information with you to ensure you live a healthier, better life. The Intimate Wellness Institute offers the most comprehensive therapies in urogynecology, cosmetic gynecology, intimate wellness, and hormone optimization in the Mid-Atlantic. We strive to offer you the most current therapies and are continuously researching new ways of doing things. We're here to offer you the exciting, fulfilling, and healthy life you deserve. Welcome.
My name is Olivia. I initially came to the Institute of Wellness because of a referral from another OBGYN. My diagnosis actually started about 20 years ago after I had my first child. I had a prolapsed bladder. The technical term is a cystocele. And I was diagnosed with also a muscle laxness of the vaginal wall. And I did have surgery about 10 years after I gave birth, a vaginal birth, and that surgery was not effective. So I gradually started having more of the prolapse return, only I also started having a rectocele, which is also prolapse of the posterior vaginal wall as well. He also diagnosed the fact that my bladder was not only prolapsed, but it was also sagging onto the ureter, which is the tube that connects the kidney to the urethra, which empties into the bladder and then your urine to void. So there was a prolapse all the way around with my organs in the pelvic region. Dr. Garrett treated my diagnosis by first listening to me. He listened to my history. He suggested doing some testing to actually diagnose what the issues were. He also talked to me and counseled me as to what we could do as far as the repair or the procedure that might be indicated for my diagnosis. The treatment has actually increased my quality of life tremendously. I'm a very active person, and as the prolapse started, it was an insidious process in which I could make time to go to the bathroom. I wore a pad, I wore support, but as time went on, those things no longer worked. And as they no longer worked, I started seeking consults for advice. Of course, everyone would tell me that you can use a pessary, there's nothing can really be done. I had a transvaginal ultrasound. I was even told everything's normal. But I knew that this bulge coming out of my vagina was not normal. I had low back pain. I was going to the restroom frequently to the point that it was starting to impact my lifestyle in the sense that I no longer wanted to travel. I love to hike. I'm an outdoors person. I started not hiking as much, not being as active. I actually, after my first surgery, I actually switched the fields in my profession, which I'm a registered nurse, and just so that I could stay off my feet more. I think the most important aspect was he actually listened to me. And the staff worked as a team at his office. He suggested that there would be certain procedures that would be helpful, but in the end, he let me make the decision as to which procedure would be best for me. The environment at the Institute of Wellness it's phenomenal. From the time of calling for the first appointment to walking into the front door, you're greeted, you're treated very like almost like a family member. Whenever there is time that lapses beyond your scheduled time, they come and explain to you what's going on. And most of the time it's because Dr. Garrett or Ms. Riley, the nurse practitioner, is taking extra time with patients because they're answering their questions fully. It's not an office where you go to and at 15 increments, someone else is coming in. I guess additionally, I would like to say that I'm very grateful that I was referred to this practice. I'm grateful for the skill that Dr. Garrett possesses and he shares with women such as myself. Oftentimes, I think as an older woman, when you go into a practice and you've suffered with birth trauma injuries, not all practices actually deal with older women's issues such as that. It's more of a maintenance issue. And so I am so grateful that this service exists. I actually travel on a good day 2 hours to just come here. So that tells you that it's well worth the visit to come if you are having any type of birth trauma issues or anything that is an issue with your pelvic floor.
Hi, my name is Jennifer Riley. I'm a nurse practitioner here at the Intimate Wellness Institute. Today I wanted to talk a little bit about a procedure that is fairly common, and it's called a vaginoplasty. A vaginoplasty is typically performed when a woman is feeling laxity or their muscles separated in the pelvic floor and the vagina. And sometimes this is from pregnancy, vaginal deliveries, but it also can be from just lifting heavy things or having a change in our hormone levels that cause those muscles and connective tissue to get weaker. So vaginoplasty really just involves pulling those muscles in the vaginal wall back together and removing any excess tissue to help give you more support in the vagina and to eliminate those feelings of laxity. It's a simple procedure. It can be done outpatient. We can do it along with more complex procedures if needed, but if this is a concern that you have, I would encourage you to speak with Dr. Garrett or myself so we can address your concerns and get you to feeling like yourself.
My name is Andrea Wynn. I initially came to the Intimate Wellness Institute of Virginia. I was having a lot of pelvic area pain, and I've actually had issues for probably 26 years after having my daughter. And there was some challenges that I had at her birth, and they did not correctly fix those challenges. And so what had happened is through the years, I was told that I had to live this way because they had fixed it to the best of their ability. And every time I went to a physician, I would bring it up again and was told the same information for the past 26 years. So you learn to live with pain. And then I had an extensive issue where the pain got so unbearable, I just couldn't function. And my primary care manager referred me to Dr. Garrett. Dr. Garrett diagnosed me with a prolapsed bladder. I had previously had a bladder sling and it had failed. I had it for numerous years. And during that visit, I had asked the ongoing question I asked every time I go to a physician, that I had this problem from 26 years ago after giving birth to my daughter, where I had significant tearing. I'm told that it can't be fixed. I was mainly saying that probably because of maybe a shock and awe factor. And after my examination, he said, this is fixable. I literally got super emotional at that appointment because I've never been told that it was fixable. And it was a life-changing deal at that moment for me. How Dr. Garrett treated my diagnosis was I had a surgical procedure back in February. He removed a bladder sling, put in a new one, and he also did vaginal reconstruction surgery. And I came into the situation optimistic, but not really banking on, is this going to fix the ongoing pain and dysfunction that I had on all levels, intimacy, bladder issues, and it has been absolutely amazing. I do recommend them to everyone and would, because for the first time in 26 years, I am living without pain. And when I say pain, it was extensive pain, along with dealing with the bladder issues that I had. I'm really at the age in life where you should not have to struggle to walk or all of that because of the extensive pain. I also see them for hormones, hormone optimization, and that has been a life changer for me. So I have more hope now kind of moving into my future, and especially with my grandchildren and my children, where I don't have to figure out how I'm going to get through a day with the pain that I was in. I would like to add, this office is one of the most considerate, and they're so nice and kind. They deal with you in a gentle way. From the time you walk in the door until you leave, the respect that you're shown and the care that you're shown and taking the time to sit and listen to the problem. I could have came in here and had them do what everybody else has done to me in my past and say, we can't deal with this, we're just gonna deal with this other problem at hand. And they listened, and if they couldn't find what the fix was gonna be, they continue just working the problem. And luckily for me, it has been, like I said, it's a life changer for me and my family at this point.
Hi, my name is Dr. Nathan Garrett. I'd like to talk to you a little bit about fecal incontinence. Fecal incontinence is much more common than you would think. People just don't like talking about it. 1 in 7 women in the United States have significant fecal incontinence, and this often happens after having babies and having the muscles and the nerves to the pelvis get damaged, or from back problems or other surgeries, or any number of things that can cause the nerves and the muscles in the pelvis not to function well. At the Intimate Wellness Institute, we have all the treatments available for fecal incontinence, so there's no reason to have to live with this devastating problem. It stops you from being able to go out, it stops you from being able to do activities that you love to do, and there's no reason you have to live with it. We have conservative therapies ranging from physical therapy that doesn't even require getting undressed, to surgical therapies that have extremely high success rates and are minimally invasive and most of the time just a quick outpatient procedure. Don't live with this when you don't have to. We're happy to take care of you.
Before, I was getting up 4 or 5 times a night to go to the bathroom. So it was interrupting my sleep. I was tired all the time. And during the day, it was, I still had issues because I'm on the strongest medication and it still is not working. It's only working maybe 50%, 60%. And then he introduced me to this, and it started right away. It just lessened. It gives me better control over when I do have a contraction. I can handle it better. It seems like it is still improving. Even in the past few weeks, some nights I have not had to get up at all. And it's awesome. And you know, I would sit in this chair and I would read a book. And I love to sit and read. I always have a book with me. And so it was just very enjoyable. Because usually when you come into a gyno's office, okay, take your clothes off. You know, I sat here in my blue jeans and just read a book. And it's the easiest thing I've ever done here.
Hi, my name is Jennifer Riley, and I'm a nurse practitioner here at the Intimate Wellness Institute. And one of the things I wanted to talk to you today about is incontinence. Incontinence is a subject that no one wants to talk about, and certainly when it's happening to you, it's embarrassing, and it's something that you feel like you're the only person experiencing. Incontinence is very, very common, as you can see from ads on TV for pads and adult diapers. And they're even making them look much prettier now. But what's important to know is incontinence is not normal. It's common, but not normal. And here at the Intimate Wellness Institute, what we want to do is fix that incontinence and get you back to feeling the way you want to feel. I know many women are unable to do the things they want to do in retirement, or even when they're still working, they have to make sure that their office is close to a bathroom, or they plan out their whole day by when they can stop in restrooms when they're out shopping. And even though this might not sound like a big deal, it really does impact someone's quality of life. So just know that there's a solution, and please reach out to Dr. Garrett or myself, and we can get you back to feeling the way you want to feel.
Well, when you walk in the front door, you're greeted by your name, and everybody has been so nice to me, and at first I think they felt my pain. They knew what I was going through with, and they went along with me and helped encourage me. It was a great experience. I mean, I felt loved. I felt like I was being cared for, and to this day, I thank God that I met Dr. Garrett. I feel great about it. I would trust my life with him. He's been great. He's encouraged me, and he told me, he goes by like steps to tell me things are going to get better. Because every time I come in, when I had the infection, I would say, I'd give anything in the world if I could get rid of it. And I hope and pray it doesn't cause me to die with infections. And he encouraged me, it's going to get better. It's going to be better. And I think at one time he said, not on my watch. I have to say, since 2004 up until now, I had a lot of times wished that I would pass away, because nobody knows the pain and stuff that goes on with infection like I had. And to know that Dr. Garrett went in there and cleaned it out and he actually brought my life back to me. And I just love it. And I have to say it, I'm depend free. And that means a lot. I wake up one time at night about 2:30 and go to the bathroom. That's it. I don't wear nothing when I go out. And he saved my life. And I recommend the laser to anybody, that it works. It works.
I just had a baby about 18 months ago, and I wanted to just go back to how I was before. It was a natural childbirth. My baby was a pretty big boy. He weighed 7 pounds, 1 ounce, and he was almost 30 inches long. So, thank God for epidurals, but I decided to try the BTL Ultra Femme 360, and it was the best thing ever. The treatment was so comfortable, it was quick, and very effective as well. So I had a lot more sensitivity during intercourse, so that was always just an added bonus for the treatment. My fiance, he has noticed, but I'm like, I don't know, I just snapped right back, I guess. This is a game changer. BTL and Ultra Femme 360 is a game changer for all women. There's no need to have labioplasties anymore if that's the problem with you. You can just have your private area look like you were 19 again. And it's fantastic to not have to go through any pain or any downtime. So BTL, it's where it's at. This is Body by BTL.
Hi, my name is Dr. Nathan Garrett. I'd like to talk to you about painless sex that women often experience. Painful sex is much more common in women than you would think. 30% of even young, healthy women experience painless sex. And once you get into postmenopausal ages, the range becomes over 50%. There's no reason to have to live with these problems. The most common reasons are menopausal changes and thinning of the tissue or drying of the tissue, and then muscle dysfunction, which is when the muscles are too tight and don't relax appropriately. These issues, when treated by an expert and diagnosed by an expert, are easily recognized and easily treated with either non-invasive or minimally invasive procedures simply done in the office with no recovery. There's no reason to have to suffer with this problem. There's no reason to have loss of intimacy and loss of contact with your partner because you're afraid of the discomfort associated with sexual activity. Please let us help you today.
I am a retired elementary school teacher. I initially came because when we moved to Richmond, my primary care doctor sent me here, and I've been here for 11 years with Dr. Garrett. When I initially came to see Dr. Garrett, I came with an InterStim, which I had placed with Johns Hopkins in Maryland, and Dr. Garrett took over the care of that and the maintenance of the InterStim, which was for bladder retention. What stood out the most during my first appointment was Dr. Garrett's compassionate, caring attitude, and also he was very knowledgeable about what I needed. I would describe the atmosphere here as very comfortable. The offices are great. The waiting area is very soothing. My treatment experience with Dr. Garrett and Jen has always been, they're very thorough, they're very caring, they follow through with everything that has worked for me. If it hasn't worked, then we've taken a different route, and they have made my life improved. Dr. Garrett, as well as Jen, are just always there for their patients. I've never not gotten an appointment when I needed it. I've always been happy with everything that goes on here.
The feeling before was it consumed my life.
You start looking, when you go places, where's the nearest bathroom? You want to be seated close to the bathroom.
I would go maybe through, like I would get up and I wouldn't make it to the bathroom, so I'd have to change my pajamas. So I'd go through maybe sometimes, 2 or 3 a day.
I would buy 2 pants that looked alike. So if I had an accident at work, I would just go to the bathroom and change into my second pair of pants and nobody would ever know. I told them what I've been practicing just to make it through work to feel normal. And then you kind of go down that road, and then age kicks in, work kicks in, the mother stuff kicks in. You just forget about yourself, and you take care of everything else around you. The next thing you know, you're starting to wear a pad.
Then when you wear the pad or whatever, then you have hygiene problems. And so it consumed my life.
To date, I'm very happy with the results that I've got from Incella. It doesn't hurt. I don't know how you would describe that.
It doesn't really hurt or feel good or anything. It's just there. It's wonderful. I don't know how it works, but it does.
I don't have dribbles anymore. And when you're out in public, I can make it to the bathroom without dribbles, if that's what you want to call it.
And now, as a matter of fact, the only problem I have is I don't think about it. So sometimes I wait too long to think about it. And then I think, but I make it.
I'm very happy on that part.
The Incella has changed my life for the better.
Hi, my name is Dr. Nathan Garrett, and I'm the CEO and Director of the Intimate Wellness Institute. I'd like to talk to you about our Hormone Optimization program. We call it Hormone Optimization because we're not designing a one-size-fits-all approach to replacing hormones. Apart from standard treatments, which is a single dose for all women treating estrogen and progesterone deficiencies, we actually take the time to diagnose the issue, understand your symptoms, and design a program of hormone optimization to get you feeling like the way you want to feel. This is done in the office with an in-office lab, as well as our experts, myself and my nurse practitioner, who will design a program to get you feeling like the way you want to.
I am a middle-aged wife and mother of one. I do accounting, and I'm going through menopause. I came because I was having issues with menopause and bladder issues, And so I did a little research online and found Dr. G. My diagnosis was I had a overactive bladder, and so I had the bladder sling surgery. And then once we got that fixed, then we started working on the menopause and the side effects of that. The menopausal symptoms was treated with the hormone replacement therapy. And I'm currently going through that now, and I can tell you it is working. And my husband is happy it's working. What stood out on my first visit was how friendly the staff was. I was greeted with a smile, and I was put at ease by the whole staff. The environment here is wonderful. Everyone makes you feel comfortable and make you feel like you're not the only one going through the issues that you're having. And it was great to find out that the whole staff is also Dr. G's patients also. My lifestyle has improved greatly. I have more confidence. I'm happier. And just my overall life has improved by the treatments that I have received here. My treatment experience here was when I first got here, I went through all the testing so that Dr. G could kind of diagnose exactly what's going on with me and pinpoint everything. And he and the staff was very thorough. I've gone through several testings that I didn't even know had even existed. And with the treatments, he was able to hone in on exactly what I needed. I would recommend Dr. G and Jennifer because they are the best. They listen to their patients. They're very patient with everyone, and they really know their stuff. I would like to add that since I have found Dr. G and Jennifer, I have learned a lot about myself and about the menopause that I'm going through, that I'm not the only one. and there's help. I don't have to suffer in silence any longer.
Hi, my name is Dr. Nathan Garrett. I'm a board-certified urogynecologist and the director of the Intimate Wellness Institute of Virginia. I'd like to talk to you a little bit about female urinary incontinence. Female urinary incontinence is extremely common. 1 in 3 women suffer from incontinence in the United States. This becomes much more common after childbearing and then again after menopause. The most common type of urinary incontinence in women, comprising about 50% of urinary incontinence, is stress urinary incontinence. And what that is loss of support to the urethra. Normally, the urethra is held by connective tissue in the pelvis that acts like a backboard or a hammock, so that if you cough or sneeze or lift or jump or are working out, it's supposed to hit that support and squeeze the urethra closed. But when you lose that support, instead it moves down and opens, and you can leak, or you feel like you have to go. The other most common type of urinary incontinence is called overactive bladder. Overactive bladder is when the bladder squeezes unexpectedly and you get a sudden urgency that you can't defer or put off, and you can't make it to the restroom in time. These two types of urinary incontinence comprise 90% of the urinary incontinence in women, either together or alone. 10% of urinary incontinence is made up of rarer conditions, like overflow incontinence, where the bladder gets so full you can't hold it anymore, or fistulas, which are holes between the bladder and most commonly the vagina. At the Intimate Wellness Institute of Virginia, we have the most comprehensive treatments for urinary incontinence, ranging from conservative therapies with pelvic floor therapy, hormone treatments, medication reviews, medications for the bladder, as well as pelvic floor therapy comprising of traditional pelvic floor therapy and advanced pelvic floor therapy with what's called high-FEM or high-intensity electromagnetic therapy, and also the most comprehensive suite of surgical therapies available. We have every treatment there is for this to suit your needs better. We look forward to taking care of you.
My name is Stevie. I'm 23 years old. I do commercial E&S insurance, and I'm a single mom. I first came to IWI because I had emergency incontinence to the point to where there was, I had no opportunity to go to the restroom. It was, I had the urge and I went on myself. So after 2 years of advocating for help, I finally was referred to a urologist, and unfortunately I couldn't get in with any in my area. So I actually had a girl from my gym who was in the room with me when I was diagnosed with my prolapse stop and recommend Dr. Garrett to me. What stood out the most at my first appointment, I felt completely heard. I felt seen and understood. You guys really helped me. You made me feel like a human. You didn't make me feel like I was a patient. I'm a big advocate because I was told for 2 years that I was fine. And then I was told that my prolapse was diagnosed as extremely mild. And when I saw Dr. Garrett, the look in his face when he told me that it was so far past mild, it wasn't even, that was kind of like what solidified. I'm glad that I'm here. And eventually I would have found my way to him anyways, because he said that he was one of 2 people in the state that could fix me. I would describe the environment at IWI as very peaceful, very welcoming. There really is not much that you need to worry about when you come here, because any questions or anything like that you have, all you got to do is call and they will answer and get you your answer, whatever you need right away. What would I tell someone who's considering care at IWI would be to 110% come here. There's nowhere else I would have rather have come, because not only are you seen, are you heard, what you feel and your questions, they're actually valued, because I feel like most people when they go to the doctor, they're just seen as a patient, and that doctor has heard that thing 100 times that day, but Dr. Garrett, he may have heard it 10 or 15 times that day already, but he doesn't care because he knows that I'm different than the last person he explained it to. So it's not repetitive to him. My treatment has improved my quality of life tenfold. My lifestyle is much different now. I just recently got 100% recovered. So from where I was to where I've come now, it's 180. The most important aspect of my experience here has simply been the customer care. I'm really grateful for Dr. Garrett for literally changing my life and making me feel like a human again.
Hi, my name is Jennifer Riley, and I'm a nurse practitioner here at the Intimate Wellness Institute. And today I wanted to talk a little bit about cosmetic gynecology. It's not something that we hear a lot about unless you actually go out searching for it, but it's something that is very common and a service that we offer here. Again, these are private issues, these are, private body parts, but what we want to get across is that cosmetic gynecology is a legitimate area of medicine, and it's something that we offer to women to get you to feel the way you want to feel. Confidence, body image, that's all a personal thing, and we have the ability now to really hone in on what bothers people about their appearance, whether it be a functional issue or just how it looks, and we can take the time to come up with a plan to treat your conditions. This doesn't always mean surgery. Sometimes things can be done in office with lasers or platelet-rich plasma. So there's a lot of options, and just know that we are here to listen to your concerns and get you feeling the way you want to feel.
My name is Kim. I am a physician assistant, and I am in my mid-40s. And ever since I had my son back when I was about 35 years old, things have not been the same ever since I delivered him. I had to have a total episiotomy, which, as any woman who has been through one can tell you, things are never the same. And so when I learned about this treatment that can safely tighten things up without having any downtime or any pain, I was really interested. It's been a great experience so far, and I had no pain, and there was no downtime. I could go work out that evening. I've noticed a difference, and my husband has noticed a difference as well. We were intimate one evening, and it was better than it had been. Not that it was bad in the first place. It was great in the first place, but it was a little bit better. He said whenever you want to do more, that he was totally on board.
Well, my name is Reina Heffernan, and I met Dr. Guerret. Why did I come? Because when I visited one doctor gynecologist, she recommended to Dr. Guerret. When I see gynecologist, she told me I can handle this because they put it to me a match for uterine prolapse, but it wasn't work. My diagnosis, it was that when I visited to Dr. Guerret, he told me, you are in good hands, very specialist. I recommend the Dr. Guerret because they are excellent doctors and especially doctors. The staff is very good. The most respect they are sparing because I am in life. Thank you, Jesus. Dr. Guerret, he treated me really good. My quality was excellent. With my experience in here in Dr. Guerret, we can't complain. Thank you, Jesus. Thank you, Dr. Guerret, because the way the time when I come in here to see the visitation Dr. Guerret for first time, I'm very depression. But now you see me. So different, totally different.
Hi, my name is Dr. Nathan Guerret. I'm a board-certified urogynecologist and the director of the Intimate Wellness Institute of Virginia. I'd like to talk to you about pelvic organ prolapse. Pelvic organ prolapse is losing support to the pelvic organs. This can include the bladder, the top of the vagina, the uterus, and the rectum. And when you lose support, it can affect bladder function, rectal function, and sexual function, as well as cause pain. The most common time that people start to lose support in their pelvis is after having children. The more difficult a vaginal delivery, the more traumatic a delivery, the more likely it is to happen, but it can happen in anybody. And then over time, as the connective tissue weakens, as our muscles weaken as we age, it can become more common and more significant. At the Intimate Wellness Institute, we have the most comprehensive suite of therapies available for the treatment of pelvic organ prolapse, ranging from pelvic floor therapy, advanced pelvic floor therapy with Emsella. In addition, we have laser therapy to tighten the tissue. That's done in 5 minutes with no preparation or no recovery. And we have the most comprehensive suite of surgical services for minimally invasive surgery available. I've been treating pelvic organ prolapse for over 25 years and have done the most surgeries of anybody in the entire region in this area. In addition, we're the only one in the region that focuses on uterine preservation procedures. There's no reason to have a hysterectomy to fix your pelvic organ prolapse. So if you don't want a hysterectomy or you want further childbearing, you can have your pelvic organ prolapse repaired. We look forward to taking care of you.
I was so excited to find the Emsculpt Neo because I'm getting multiple treatments in one device. And so for a mom of 3, that is a win-win. I'm all about saving money, I'm all about saving time so I can spend more time with my family. Getting the Emsculpt Neo treatments, it definitely helped build my muscle and melt my fat away. I feel stronger when I do workouts now, and I feel like I can be that much more competitive. With these treatments, I really lost inches, and in 30 minutes, 4 times, it was melting my fat away and working out my muscles in a way that I could never do in the gym. I feel like with Emsculpt Neo, you get a lot more for less. Like, I got 2 treatments in one. It's such a short period of time, and I just feel like I was completely satisfied. I've tried other treatments, and I feel like this did the most to my body for the least amount of time and money.
My name is Joyce McDaniel. I originally came because I was having bladder problems. I had prolapse and I had frequent UTIs. My first appointment, everyone was so caring and congenial, and I really felt comfortable here. Dr. Garrett, first of all, gave me surgery for the prolapse, and he attached some mesh to help with that. And he also would prescribe the correct medication for my UTIs. Prior to my treatment, in the last few years, my UTIs had gotten much worse. They were coming like every other week, and my family doctors were getting very concerned and said that I had to find a specialist. And so a friend of mine gave me a card with Dr. Garrett's name on it, and I immediately called him and I got an appointment, and I came and I never regretted coming. My treatment has really improved my quality of life due to I was having excruciating pain with those UTIs, and it was like I was getting ready to just give up. And Dr. Garrett, he was so optimistic that he could help me, and he has. They are both so congenial and personal and professional and knowledgeable, and I think anybody that came to them would appreciate being here. I would express my feelings about here as wonderful. It was so nice to finally find a doctor that was interested in helping women, and it's just been a great ride. I'd like to add, one day I had a treatment, and I was very nervous about it, and when we got finished, I said, "Dr. Garrett, I love you." And I meant to say, us women appreciate you, but I told him, "I love you." I think I shocked him. He's really a wonderful doctor.
Hi, my name is Jennifer Riley, and I'm a nurse practitioner here at the Intimate Wellness Institute. Today I wanted to talk a little bit about hormone optimization. Generally, you start thinking of hormone replacement therapy for women that have hit menopause, or you see the memes and the jokes about hot flashes and irritability. But one thing that we want you to know is certainly hormone optimization in menopause is something that is definitely needed, but also the time before menopause. This is referred to as perimenopause, and it can actually last for even up to 10 years. And women often have the same symptoms of menopause when they're in perimenopause, but simply throwing estrogen at them will not do them any good. So here at the Intimate Wellness Institute, we take the time to listen to your concerns, take inventory of your symptoms, do a thorough exam and blood work, and then come up with a care plan for you. After developing a care plan, we have the ability to offer both conventional methods of hormone replacement therapy, but also bioidentical hormone replacement therapy. And this is something that many women will choose over synthetic hormones. And what we do is we offer something called a bioidentical hormone replacement therapy pellet, which is made from plants. So they're plant-based, developed in a compounding pharmacy, and they're developed just for you. So we take a look at your labs and your symptoms, and from that we can come up with a dose that would be dependent on you and treat your symptoms. So I would highly encourage you, if you are feeling any symptoms of hormone imbalance, to speak with Dr. Garrett or myself. Let us know how you're feeling, and from there we can take a look at your labs, your symptoms, and then develop a care plan for you.
I can't tell you how depressing it is when you have your favorite outfits that you really, really want to wear, and you can't because you don't feel like you look good. You feel like it's just this one-way street to Frumpy Town. So all my friends were trying Emsculpt, and they were running around showing off their booties, and they looked great. They looked amazing. But honestly, that's not the area I need to help. It's these friggin' saddlebags. So people were telling me you have to first freeze the fat, then you have to tighten the skin, then you have to do the sculpting for the other areas that you didn't get the first time. I don't have time for that, quite frankly. I'm busy. So when I found out about the Emsculpt Neo, I found out it combined all of those. I was able to melt away the fat, and it toned my muscles, all combined in a half-hour treatment, and I did that 4 times and it combined everything, and it was amazing. I feel amazing. I feel like a new me. I am empowered by Emsculpt Neo.
My name is Brittany. I initially came to IWI because I was having problems with painful urination and frequent urination. So I have interstitial cystitis is my diagnosis, and I have frequent urinary tract infections. Dr. Garrett has treated my diagnosis with both surgery, medication, and lifestyle changes. My quality of life prior to my treatment was much different than it is now because I had a lot of unknown. I had no idea what was wrong with me and why or how to fix it. And so now I have a much better idea of what's going on with my body and the things that I need to do to help be more comfortable, have a better quality of life. I would describe the environment at IWI as very comfortable and warm and welcoming. I would recommend both Dr. Garrett and Jennifer Riley because they're both very personable and attentive. They listen to what you're saying and they give honest feedback to what you have going on, and you know that they're giving you the best options. I would just like to add that both staff and the environment are very friendly and personable and welcoming, and they listen to what you have to say and give you comprehensive options to work through and speak with you about and give you great explanations on what those options are and the long-term consequences of those options.
Hi, my name is Dr. Nathan Garrett. I'm the CEO and director of the Intimate Wellness Institute of Virginia and a board-certified urogynecologist and pelvic reconstructive surgeon. I'd like to talk to you about cosmetic gynecology. We are the foremost center for cosmetic gynecology in the Mid-Atlantic, and I have over 25 years of experience treating women for these issues. We have the most comprehensive array of treatments, including non-invasive treatments with injectables, lasers, radiofrequency, and we also have excellent muscular treatments that include using what's called high-intensity electromagnetic therapy, which strengthens the muscles in the pelvis, as well as the full surgical array of treatments. Even the surgical therapies are done in the office as a simple outpatient procedure. Oftentimes, in adolescence or after having babies or with menopause and aging, the tissue in this area can change. It can change in appearance, it can change in function, and many people are often dissatisfied with how the tissue appears. Our philosophy at the Intimate Wellness Institute is this is no different than any other part of the body. And if it's causing you embarrassment, if it's causing you loss of confidence, if it's causing any functional issues, there's no reason to have to live with it. If you have a responsible provider that can discuss appropriate treatments and provide them to you in a safe and correct manner, there's no reason not to seek help. We look forward to taking care of you.
Initially, I chose to see Dr. Garrett at the recommendation of a friend. I trusted her, and she was thrilled with what he had done for her and for others. And I gave it a shot and came, and I certainly don't regret it. He is so gentle. He doesn't rush in, gotta go, what time, anything else, okay, bye, okay. You don't feel like you're being run through a cattle stall. He sits and he talks in a very gentle, straightforward manner, and he explains. He has models, he shows them, explains what he's gonna do, what has happened to you, and how to fix it, what it's gonna take, the kind of process, and if that does not work, then something else is going to work. So I really like that he is even willing to sit down and discuss actual tracings with me. Very, very patient and just compassionate and very gentle, laid back, just a human being. That's the truth. No fancy jewelry, no fancy suits. He's just a real person. And that, for me, makes it easy to talk to him. And then he's very open. He is the only doctor in my life who has ever said to me, so how is your sex life? Are you happy with that? No gynecologist has ever asked me that. They never cared. It wasn't part of their pap smear. But he does talk about sexual health. Some of the things that he has done for me is laser internally. And the reason that I could, again, talk to him about that, he had something to suggest. I would never have come in here and said, I need to have my vagina lasered. It wouldn't have occurred to me. I didn't even know about it. But he suggested that. And when he brought it up, he is just so professional and not pushy, not intrusive. Just, this is an option you might consider. This is another option. This will, how are your orgasms? What gynecologist has ever once talked to me about, has ever used the word orgasm? That's what I like so much, is this is help for any urology issues you're having. And I had overactive bladder, and that has been addressed to my satisfaction 100%. I'm just really happy. Really happy. And I'm so glad to find a doctor who made that first gesture. How is your sex life? Tell me about, are you okay? Are you happy? And because of that, I told him things I've never told another doctor, probably another man, to be honest. So it was his manner. I'm really, really pleased with his service.
Hi, my name is Jennifer Riley, and I wanted to talk today a little bit about pelvic organ prolapse. I'm a nurse practitioner here at the Intimate Wellness Institute, but I'm also a patient. I had surgery a few years back to fix my prolapse, and it was life-altering. Prolapse in women is very, very common, and it's something that they often don't know they have. Patients/women can have symptoms of just lower back pain or pelvic pressure, or can sometimes actually feel a bulge coming out. It's something that's personal and private, so we don't tend to talk about it. So you often go on living as though this is just something that you have to deal with, or something that is going to be that way for the rest of your life. What I found here is Dr. Garrett takes the time to listen to people and see what their concerns are, but then after doing a thorough exam will give us options. You know, the good thing is it's not always surgery, and if there's a non-surgical option, it's certainly something that enters the discussion. And just on a personal note, as I said earlier, it was life-changing. I no longer have to worry about pressure, back pain, and sexual dysfunction that sometimes goes along with the prolapse. So I would highly urge anyone that is having these issues or just feeling like something's not right to reach out to a provider or come here to the Intimate Wellness Institute and know that we will listen to your concerns, do a thorough exam, and get you back to feeling the way you want to feel.
I came to see Jen for the purpose of some type of hormone therapy. I was 5 years into menopause. I was suffering with anxiety, night sweats, lack of focus, concentration was at a 0. And so she suggested that they could do blood work, find out exactly where I was personally, and come up with a non-synthetic hormone therapy that could bring me back to more of my normal self. And so that's what we did. We did the blood work, and then I had a pellet made up specifically for me, and that was a very easy procedure to have it inserted under the skin, and it's just been a great experience. That first night, from that point on, I never had an anxiety attack in the middle of the night. I never had the hot flashes, and I don't have sleep deprivation. I'm laser focused at work. So I immediately saw a change in my overall wellness with the pellet. When I met Jen, Of course, you know, when you first meet a new doctor, you have to figure out, is it going to be a good fit? And she immediately made me feel like I was talking to an old friend that was a wealth of information and just a wealth of knowledge. So I was comfortable right from the first conversation with explaining what was going on with me, what my concerns were, and she just made me feel like I was talking to a friend who had been through the same things that I'd been through, and she had suggestions, and I wasn't pushed in a direction. I was given the information that I wanted or needed, and I was able to make my own decision about what would work best for me. And I felt totally supported by her in that process. I have recommended this practice to everyone and anyone who will listen to me. I've actually had people come up and say, you look different, you look like you feel better, because I really was struggling. I struggled for 5 years, and it was noticeable to the people around me. And I've had people come back and say, I see a change. And so I have recommended Jen to anyone and everyone that I can, because I believe in this practice. It's a small environment. It's the women that are here, we're all going through the same thing, and the support from the staff it feels personal. It feels like it's a real family connection. So it's been a great place to come myself, and I'm very comfortable recommending friends and family. In fact, I feel like a poster child for them. I think everyone should at least have a conversation with Jen to see what are my options, and is this a good fit for me? Do your due diligence to see if this is a good fit for you. So one of the reasons that I'm so comfortable with Jen is that she is a woman of the same age, going through the same thing. She too does the hormone therapy. So when she speaks to me from experience. And that gives me comfort that the process that I'm going through is something that she's gone through as well. So she's actually been able to tell me what to expect, when to expect things and what to expect. So it's been very comforting to know that what I'm having done, she's already had done, and that just makes me feel more comfortable with making the decisions that I've made.
Here's how it's going down. First, we hit the pharmacy on Flower Park. Then we hit the gas and go on Poppy Meadow. Not the quick stop, too messy. Then we loop back around in the alley behind Mom's Thai kitchen. There's a restroom in the back behind the kitchen. Then we're in the home stretch. Just one quick hop over to the plush bathrooms at Shooters and we're home free. You got it? You ready?
Honey, we're going to the market.
Are frequent bathroom stops making everyday tasks feel like an impossible mission?
You're right. What was I thinking? We're gonna need more bathroom stops on the way home in case we get coffee.
There is a solution, should you choose to accept it. Try BTL Upsella today and disavow your stress urinary incontinence.
Hi, my name is Dr. Nathan Garrett, and I'd like to talk to you about the team at the Intimate Wellness Institute of Virginia. The issues we take care of, urogynecology, aesthetic gynecology, advanced gynecology, hormone optimization, and many other intimate issues associated with women's care are often difficult to talk about, embarrassing, and often stop people from seeking help. The team at the Intimate Wellness Institute is an expert team that I've worked with for many, many years, and I'm very proud to say that they are incredible at making people feel comfortable, welcome, heard, and make sure that you get the care you deserve. So please come see us and let them take care of you.
My name is Catherine, and my friend Stephanie works here at the office, and she told me about this trial. So I tried out the butt lift, and I really like it. And I really like it because it really made a difference on my backside. It got more lifted and more like put in place. I have 2 kids, and I don't have a lot of time to work out. So that really helped me to, jump or skip the workout and still have the shape that I wanted without the workout. But I feel more confident. I just know that my butt is in the right place. The procedure was, it took an hour. They had those electric shocks go through your body, but it wasn't painful. And you know, when you have the result in mind, it makes it so much easier to go through it. This is Body by BTL.
My name is Kendra, and I initially came to IWI just because I had some concerns that I wanted to discuss with Dr. Corrett. My past healthcare experiences were not as personal as they have been with Dr. Corrett and his staff. They really listened to me, and I feel like they addressed my concerns. What stood out the most about you guys during my first appointment was I didn't realize that there was actually treatments for the concerns that I had. The environment at IWI was very friendly, it was warm, it was personal. I would describe the staff at IWI as friends. They were like family, they were very welcoming, they were down to earth. The reasons I would recommend you guys to other patients would be I was actually able to achieve the results that I was looking for. I would recommend Dr. Nathan Garrett because I had some concerns that he was able to address. When I came in and consulted with him about it, he was able to give me the results that I was looking for. The most important aspect of my experience was the change that it gave me and the confidence that was restored from those results. I'd like to add that if you're considering having any procedure done, whether it is cosmetic or medical, that you would consider Dr. Garrett and his staff at IWI. I feel that they are very personal and they will address all of your concerns, and I also feel that you'll be very pleased with the results, as mine were life-changing.
Hi, my name is Dr. Nathan Garrett. I am the CEO and Director of the Intimate Wellness Institute of Virginia. I wanted to talk to you a little bit about advances we have in pelvic floor therapy. Our most recent advance is called high-intensity electromagnetic therapy. And what this is a gentle electromagnetic therapy in a chair that you sit on fully clothed. And it's a half an hour session twice a week for 3 weeks. And what this does is it exercises the muscles in the pelvis in what's called a supramaximal fashion, meaning it contracts the muscles faster and harder than they can contract on their own or during a traditional therapy session. And because of that, we've seen remarkable improvements far above what we had seen in the past. The types of conditions that we can address with this include urinary incontinence, bowel control issues, pain with sex, looseness during sex, and pelvic pain in general. It's about as easy as you can possibly get. No pain, no downtime, half an hour to sit and relax and read a magazine. We'll hope you take advantage of it. Thank you. Hi, my name is Dr. Nathan Garrett. I'm a board-certified urogynecologist and pelvic reconstructive surgeon and the director at the Intimate Wellness Institute of Virginia. I'd like to talk to you about minimally invasive surgery for pelvic organ prolapse and urinary incontinence. The Intimate Wellness Institute of Virginia offers the widest array of minimally invasive surgical therapies for urinary incontinence and pelvic organ prolapse. I am currently the director of robotic surgery at the medical center and have the most experience in both minimally invasive vaginal and robotic surgery in the region. We can treat these problems that used to require multiple day hospital stays and a long recovery with a rapid procedure, either outpatient or one-night stay in the hospital with minimal recovery and with improved results. We look forward to taking care of you.
Hi, my name is Jennifer Riley and I'm a nurse practitioner here at the Intimate Wellness Institute. I've worked with Dr. Garrett for years and I can honestly say that I feel privileged to be a part of this practice. One thing that is very different and what I feel sets us aside is Dr. Garrett takes the time to listen to patients, take into consideration not only their symptoms, but how it's impacting their quality of life. And what we really here want to focus on is not just your medical condition, but also your quality of life. At the end of the day, that is our goal, is to get you to feel the way you want to feel and make sure that you're able to do all the things you want to do. Another thing that sets us aside, I believe, is that we don't just focus on one thing, but we really are interested in intimate wellness. And that not only is your pelvic floor health or urogynecology needs or hormones, but also, just your quality of life. So we really want to help you with weight loss or getting on a better exercise plan, just talking about different supplements that could be beneficial to your health, and just take a functional approach to medicine along with the conventional Western approach to medicine to really look at your whole self and develop a care plan that can really get you to optimize your health and wellness.
Hi, my name's Rose and I'm recently retired, so life is great these days, having a lot of fun. I'm married, have 2 children. Well, I came to see Dr. Garrett originally in his other location. I've been coming here since 2015. So I saw him back in 2015 for a problem with a bladder. Well, my past experiences, I think, were pretty good. I had good health care, but what I found is I was having a combination of 2 issues. I was having urology problems and gynecology problems. So I came to Dr. Garrett because he could take care of both issues. I think the thing that stood out most about the office is that I really felt like, number one, Dr. Garrett understood what I was talking about when I started talking about some of the bladder issues I had. And number 2, everybody just seemed really very caring, very caring. I really appreciated that. I think the reason that my health care or my care here is different with the Wellness Institute is that, number 1, I can get so many treatments for so many different things. What I've found through the years is it's not just one thing that I came here for. I've had multiple issues. And so Dr. Garrett's been able to treat several different problems that I've had, female problems, female pelvic problems. And that's what I've been very happy about, very satisfied with. I think the staff is great. I think the staff is wonderful. They actually know you, and I know there's a lot of patients here in this practice. I know he has a lot of patients, but when I call, I feel like they know who they're talking to. They know they're talking to me. I feel like when I'm talking to one of the staff members, they remember who I am. They remember things about me. They're always very professional and very sweet. I would recommend Dr. Garrett and Jen to all of my friends, and I do recommend them. I really feel that it's important for women to have really good health care, and being able to go to a urogynecologist is really, it's just the best of both worlds, because you don't have to go to 2 different specialists to be treated, and they can take care of so many different issues at the Institute? Well, I've had several diagnoses here. I was diagnosed originally with bladder issues, and then I now have what's called painful bladder syndrome. I had vaginal atrophy, so I've had several different treatments here through the course of the last 7 years. With all the different treatments that I've had a combination of different things. With the bladder, I had a bladder attack, which was surgery, and it was one of the best surgeries I ever had. I was going to the bathroom all the time, and that eliminated all of those problems, and I've had none since, and that's been years now. And then with the vaginal atrophy, I was able to have the DIVA treatments, the laser treatments, and then with the painful bladder syndrome, I've been having different treatments with that. A lot of it is medication, and it's also things that you have to do at home. But I've been able to get really good care with all of the different treatments that I've needed.
I'm 58 years old. I'm a mother of 2 and a grandmother of 2 girls. Both, they are going to be 7 and 12 next month. And I am a life insurance agent as a second career. And I spent 28 years doing healthcare sales and marketing before that. Well, I originally came to the Institute of Wellness before it was actually named that. I got introduced to Jennifer Riley, the nurse practitioner, initially for my postmenopausal annual GYN visits. I think that, of course, I didn't know Dr. Garrett for several years. I always worked with Jen for several years until I had the issue that I have now, which is why I continue to come here and will always come here, because Dr. Garrett helped me and fixed me. So I think my experience here is very different because of my condition. I've had to come here a lot in the last year, and it really matters when everybody is so pleasant. And you know, when you have to come to the doctor, you definitely want it to be pleasant, but when you have to come a lot, it really does matter. The staff here is awesome. They're very accommodating, very kind. My condition is one of those that it's kind of up in the air and kind of a roller coaster at times, and so I often have to make last-minute appointments, so they're very accommodating when I need to do things like that. I would definitely recommend the Intimate Wellness Institute for many reasons, not only for my own personal reason, but I've been impressed with them even coming as just a postmenopausal woman on an annual basis. And so I'm really glad that I found them early on and that Dr. Garrett is here to do what he does. So my diagnosis actually started a year ago, and we eventually found out that my diagnosis is a neurogenic bladder with dyssynergic voiding. And what that means in simple terms is my sacral nerve does not work right. I was treated by an implant that I now have for the rest of my life that now controls that nerve where it should normally be. So it now helps me to have a normal bladder and normal flow. And I would recommend Dr. Garrett and Jennifer because first of all, they're extremely intelligent. They know their trade, they know their stuff, and you can tell that they're constantly keeping up on things. Jen is always talking to me about, I go to Jen now for hormones, because I come here for that too. And so Jen takes care of my hormones, and I always know that Jen is always kind of doing her education and keeping up on today's things because she's always educating me. So that, is really important. And as far as Dr. Garrett, I mean, he's just really, he's one of those doctors he's really smart, but he's also got a great bedside manner too. So the one word I would use to describe my experience here is life-changing.
My name is Dr. Nathan Garrett. I'm a board-certified urogynecologist and pelvic reconstructive surgeon, and I'd like to talk to you a little bit about orgasmic function and dysfunction in women. Orgasmic dysfunction in women is more common than you would think. In the media, you frequently hear about erectile dysfunction and other male sexual issues, but you don't really hear anything about female sexual issues. And female sexual issues are just as common as male sexual issues. Oftentimes, women lose sensation with sex as they age and can lose the ability to have orgasms and also start to have pain with sex. At the Intimate Wellness Institute, we have all the treatments available for the treatment of orgasmic dysfunction, including platelet-rich plasma, which is just purifying your own growth factors in your blood and putting it back into that tissue to have you have restoration of your sensation, as well as treatments with laser therapies and radiofrequency therapies that restore the blood flow and the sensitivity to the tissue, and a brand new therapy that we've done the initial research on called extracorporeal shockwave therapy, which is just ultrasound shockwaves stimulating the tissue to regrow the blood vessels and nerves. It's all done in the office. There's no pain and no recovery associated with any of these treatments, and the results are fantastic. We look forward to taking care of you for this problem.
My name's Nicole. I'm married. I have 2 kids. They're 10 and 8. The original reason I came to IWI was a few years ago. I was experiencing extreme pain with motion, walking, jumping, running. I couldn't jump on the trampoline with my kids or play outside. And doctor after doctor just told me, you're fine, until I came here. My past healthcare experiences before coming to IWI were the norm. You walk in, you tell them what's wrong, and you leave with no answers or anything that you came to figure out what was wrong with you. What stood out about my first appointment at IWI was the fact that I was in the exam room, I was being heard. After a few minutes of the exam, IWI diagnosed me with something that I kind of had a feeling was going on, but all the other doctors failed when it came to that. The environment at IWI, I would say, is very calm, peaceful, and extremely clean. The staff at IWI is amazing. Every phone call, every email, everything from surgery to post-surgery, any exam in between has been nothing but amazing. The main reason I would recommend IWI to other patients and my personal friends that have the same issues that I had is life-changing, absolutely life-changing. What I would tell somebody at IWI if they're considering care here is they're going to walk in with fear and not knowing what's going on with their bodies, and they will leave with an answer and hope for the future and how healthy you can actually be. My diagnosis when leaving IWI was I had uterine prolapse, so my bladder had to be repaired and tacked up to the lining of my sacrum. Also, I had to have cystocele repair, rectocele repair, and then I also opted for a cosmetic surgery, a vaginoplasty as well. So my treatment experience is you come in, you get diagnosed, see what's wrong, see what the course of action is, and not only that, IWI makes sure that they run every test they possibly can before surgery or before any procedure to make sure that they're going to fix everything that they need to. It's really reassuring knowing that this might be wrong, but we're going to make sure what is exactly going on with your body before we do anything. My treatment has changed my quality of life and lifestyle tenfold. I feel like I look better, I walk better, I just feel so amazing about my body. I had no idea that women's health was such a need, and IWI really makes sure that women's health is put first, and it's just great to feel that. The one word that I would describe being here is life-changing. It's life-changing because there's no other place that I've ever been to that actually prioritizes women's health, and it's amazing. The one thing I would add is that I can't thank this whole entire team enough for making my life so much better. Not just inside, but outside, how I feel, how I just carry my whole entire self now. It's just life-changing and I love it.
Ever feel like you're missing from your own life just because you always have to run off to the bathroom? Those days are over. Be the star of your own life again with BTL Emsella.
Hi, my name is Dr. Nathan Garrett. I'm a board-certified urogynecologist and pelvic reconstructive surgeon and a director at the Intimate Wellness Institute of Virginia. I'd like to talk to you a little bit about vaginal tightening procedures. At the Intimate Wellness Institute of Virginia, we offer the most comprehensive solutions for vaginal tightening available. Often after having children, things aren't quite the way they used to be. It can affect sensation with sex, it can affect pressure in the pelvis, can impair your activities in other ways. We offer both non-surgical and surgical therapies using advanced pelvic floor therapy, laser or radio frequency tightening therapies, as well as surgical therapies that most often can be performed in the office. We look forward to taking care of you.
So I grew up with my mom talking about having this incontinence issue. I didn't want to be one of those moms that just because I had kids, I had to give up on myself. My experience with Emsella was easy and kind of exciting. You sit down, stand up, walk out, you're done. I haven't peed my pants since. Like, I really haven't. Every time that my husband and I are intimate since I've had the treatment, it has increased the pleasure and the satisfaction. We didn't have a problem before, but he's like,
yeah, I noticed the difference.
It is a life changer. It has definitely given me more confidence, and I don't feel like I have to prepare for an emergency all the time. Empowered by Emsella. Is this so exciting?
Hormone replacement therapy is something that we offer here at IWI to women during different stages of their life. As women, we spend most of our lives dealing with shifts in our hormones from the time we start our periods till the time we stop having periods. Our goal here is to really empower women to live their best lives, and so what we're focused on is balancing hormones versus just replacing what we've lost. At the end of the day, the ideal candidate may come to us feeling symptoms of hormone imbalance that can vary from hot flashes and mood swings, vaginal dryness, urinary symptoms, to low libido, weight gain, depression, anxiety, or just not feeling like themselves. So we have at our disposal utilizing conventional methods, using commercial products, or going to bioidentical hormone replacement therapy. Bioidentical hormones are basically plant-based products that mimic what our bodies naturally produce. So by utilizing these, we are able to provide women with products that oftentimes have less side effects. One of the misconceptions is that women have to have experienced menopause to be candidates for hormones, and what we know now is the period of time before menopause, which is called perimenopause, can actually range up to 10 years. And that is when women oftentimes need the most help. So just because someone still has periods does not mean that they can't benefit from rebalancing their hormones. And it might not mean just estrogen and progesterone. It might be utilizing testosterone, or even looking at their labs and vitamin levels, and really making sure that we're optimizing their health in all aspects.
Hi, my name is Dr. Nathan Garrett. I'm a board-certified urogynecologist and pelvic reconstructive surgeon. I'd like to talk to you a little bit about cosmetic gynecology, or aesthetic gynecologic surgery. The Intimate Wellness Institute of Virginia is the most experienced and most comprehensive center for cosmetic gynecology in the Mid-Atlantic. We focus on minimally invasive techniques, as well as non-surgical techniques and surgical techniques, and frequently can just be done in the office with minimal recovery. We cover both labiaplasty, labiamajaroplasty, which is labial reduction, vaginoplasty, which is vaginal tightening, clitoral hood reduction, as well as a host of other therapies to achieve the cosmetic result that you desire. We firmly believe that there's nothing different about this tissue in the body than anywhere else in the body. As long as you have reasonable expectations about your results and you have somebody who can provide you expert care, there's no reason not to take care of this problem. We hope to see you soon.
After reading some Google reviews, I just thought that I should give Dr. G a chance, and it was one of the best decisions I've made. So I would definitely recommend Dr. G to any of my friends or family, just because all my questions were answered from start to finish, and it was a very personable experience that I had. And overall, it just made me feel like a better woman. So yeah, I would definitely recommend. And he also performed a sling procedure for my incontinence. After the procedure, my recovery was better than I expected. So my vagina is tighter, my sex life has improved, and my confidence is just through the roof.
Hi, my name is Dr. Nathan Garrett, a board-certified urogynecologist. I'd like to talk to you today a little bit about chronic urinary tract infections. Chronic urinary tract infections are a large issue, with over 70 million women in the United States getting urinary tract infections a year. It's one of the most common reasons why women get institutionalized and often causes a significant impairment in their quality of life and frequently causes emergency hospitalizations. Chronic urinary tract infections can be a devastating issue in women's lives. It can start to become a common problem after having children, and then again becomes more common after menopause. Oftentimes, chronic urinary tract infections can mean something more serious is going on, so you should never ignore it. At the Intimate Wellness Institute of Virginia, we take this problem very seriously. We offer you a comprehensive workup to provide you a clear solution and a comprehensive treatment plan. We look forward to taking care of you.
My name is Erin. I initially came to IWI was for continuous bladder infections that were not clearing up after antibiotics over a 6-month period. My past healthcare experiences before coming here were always very good. I didn't really know to address a lot of these issues with those doctors, and I continued to see my primary care until he no longer really knew what the problem was and directed me toward Dr. Garrett. During my first appointment here, what stood out the most is that everyone was very caring and really took the time to listen to my concerns. The environment at IWI is very calming and quiet and sort of like a spa-like atmosphere. The staff at IWI is awesome. Everybody is perfect, and it's like coming in and talking to friends. You see the same people, and everybody remembers what's going on in your life and takes the time to chat. Even when everybody's running busy and wild, you never feel like you're rushing out. The main reasons I would recommend you all to other patients is the overall care is very good. Nothing's really left unanswered. It's just been a great experience for me overall. I just wouldn't change really anything. My diagnosis at IWI is, I'm not sure if I'll say this exactly correctly, but the main issue at the time for the bladder infections was a prolapsed bladder and also an erectocele. Sort of prolapsed everything. So at that time, the surgery was going to be done to correct all the bladder issues, and it also took care of many other issues that I didn't realize would be taken care of. When it came to exercising, jumping around, laughing, sneezing, just the bladder leakage was just, I think a lot of people tend to live with. Now, after my surgery, all these symptoms have been taken care of. All those things are not a problem at all. I would recommend Dr. Garrett and Jennifer Riley both for their professional aspects. They're bright. They know everything that's going on once they get to know you and diagnoses are made. The care is excellent. To me, it's a gold standard, and they're always on top of your care every time you come back and rechecking and make sure everything's where it should be. One word to describe my experience with you all would be, it was exceptional. I can't say better things about this practice and what they can do for you, and I have sent many people here, off the top of my head, probably 6 or 7 for many different reasons, from pellets to surgery, and all of them have been very happy, so it would be a great choice. You can't go wrong.
Hi, my name is Dr. Nathan Garrett. I'm the CEO and Director of the Intimate Wellness Institute. I'd like to personally welcome you to our institute. We are the most expert center in the Mid-Atlantic for urogynecology, advanced gynecology, aesthetic gynecology, and hormone optimization. Our promise to you is to provide expert care in a comfortable, clean, and understanding environment so that you can address these intimate issues without feeling judged, without embarrassment, and getting the expert care you deserve. We look forward to taking care of you. Hi, my name is Dr. Nathan Garrett. I am the CEO and Director of the Intimate Wellness Institute of Virginia, as well as the CEO of the Intimate Wellness Institute, which is our sister teaching institution. I wanted to talk to you today a little bit about advances in menopausal care, particularly vaginal dryness and vaginal irritation that occurs with the loss of estrogen. We have the most comprehensive array of treatments in the Mid-Atlantic, and they are composed of advanced laser therapy, which is a gentle intravaginal laser that's placed into the top of the vagina and is just moved in a circle on the way out. It takes about 5 minutes to do. And we've seen remarkable improvements in vaginal dryness, pain with sex, vaginal looseness, and there's no downtime associated with it. In addition, we have radiofrequency treatments, which work similarly, but recent advances in the radiofrequency treatments have also had remarkable success. And we also use platelet-rich plasma treatments, which is using your own blood products to improve your tissue with the growth factors, as well as advanced pelvic floor therapy. And with that, we have by far the most advanced treatments available for women with these types of conditions.